As Chief Medical Officer for our San Luis Obispo County Jail, I'm responsible for all health care that's delivered inside of our jail. And for years, jails across the United States have been struggling with an increased number of people with mental illness behind bars. Our jail is no exception. We have about 600 people in our jail at any one time, and we know that 1/3 of them suffer from mental illness. This compares to a national average of about 1 in 5 people who suffer from mental illness. The other thing that we know is, on average, people with mental illness will spend twice as long behind bars for the same crime. There are many reasons for this, but one of the main ones is that people with mental illness have a lot of trouble navigating the court system. And also, we know that people, on average, with mental illness have a higher recidivism rate, meaning that once they leave custody, they have a higher chance of coming back. So that's the bad news. If you're mentally ill, you're more likely to be incarcerated. Once you're there, you stay longer, and after you leave, you have a higher chance of coming back. But there is some good news. There is a national response to this epidemic, and it's called the Stepping Up Initiative. Simply put, the Stepping Up Initiative is the effort to decrease the number of people with mental illness who are behind bars. So counties can join this effort, and through the effort, they can meet with other counties to figure out what's worked. They can figure out how to start programs and how to get funding, and also learn how to use data to track progress. San Luis Obispo County joined the Stepping Up Initiative in 2017, and I'm proud to say that in 2019, we were recognized as an innovator county, one of 15 nationwide, for leading our peers in this effort. So I'm going to tell you a few of the things that we've done. We implemented universal mental health screening at booking, meaning that every single person who enters our jail is assessed for mental illness. We remodeled part of our jail using funds donated by the community into a brand new behavioral health unit. This unit is dedicated to the treatment of mental illness and substance use disorders. We started our own jail-based competency treatment program inside the jail after watching our patients wait 3 months or longer for a state hospital bed. We decided to bring that program in-house, and we virtually eliminated that wait time so they can get treatment faster. And we started our new Kansas Max housing unit, which is a 77-bed facility that has revolutionized the way we think about mental illness. Instead of having people housed by themselves, where they don't usually do very well, we have housed them in small pods, and this has increased a sense of community and socialization. We started an incentive-based program where we reward positive behaviors such as taking medication, exercising, and keeping your cell clean. And the deputies that staff this unit are specially trained and wear a casual uniform, so it seems less institutional. The results we've seen from this housing unit are amazing. We have increased medication compliance, decreased episodes of violence, and decreased transfers to our psychiatric health facility because of acute mental health crises. So these are just some of the things that we've done inside of our jail. But the truth is, this problem of too many people with mental illness behind bars is not just a jail problem. This is a community problem. We need to intervene earlier before people even enter the criminal justice system. We need to increase mental health services in the community. We need to increase training for law enforcement on how to interact with people with mental illnesses. And we need to increase the use of community action teams, which pair law enforcement with mental health workers. They go out into the community and find people where they live, help them connect with services so that they never end up in jail in the first place. Thank you for your time.